If you have been taking a blood pressure pill every single morning for the past year, whether it is amlodipine or losartan or lisinopril, I need you to ask yourself a very serious question right now, and I do not want you to answer it in your head with the easy answer. I want you to answer it with the brutal, honest truth that lives in your gut and not in your ego. And that question is this: how confident are you that you truly understand what that pill is doing inside your body right now? And I do not mean what the label says in that tiny font that you need a magnifying glass to read, and I do not mean that one sentence I need you to do something for me. Subscribe to this channel right now and video like me, pharmacist printed on the bag as they were rushing to help the next person in line. And I do not mean what your neighbor told you or what you read on a random website that was more interested in selling you something than saving you something. I mean, actually understand it with the kind of clarity that could save your life in the middle of the night when something feels wrong and you are alone and you have to decide whether to call for help or go back to sleep. And I am asking this because I have seen the pause, I have seen the hesitation, I have seen the look in the eyes of incredibly smart people. People who have managed companies and raised children and balanced checkbooks and built careers from nothing. And when I ask them what their blood pressure pill actually does, they pause. And that pause is not a small thing. That pause is a window into a much bigger problem. And the problem is that we have convinced ourselves that because we take a medication every day, we understand it. And because our doctor prescribed it, we are safe. And because we feel fine, we are out of danger. And I am here to tell you with the utmost respect and urgency that those assumptions are the very things that can quietly turn a manageable condition into a medical catastrophe. And we are going to spend the next hour together pulling back the curtain on 3 of the most commonly prescribed blood pressure medications in the entire world. And I am going to give you the kind of information that your doctor would tell you if they had an hour instead of 10 minutes. And I am going to give you the kind of information that your pharmacist would print on that bag if there was enough room. And I am going to give you the kind of information that your body wishes you already knew, because your body has been sending you signals every single day, but you have not been trained to understand them. And that is not your fault, but it is now your responsibility. And I want you to take this seriously, because these are not weak medications, and these are not vitamins, and these are not supplements that you can take or leave, depending on how you feel in the morning. And these are not sugar pills that gently nudge your body in the right direction. Amlodipine and Losartan and Lisinopril are powerful drugs that change how your heart and your blood vessels and your kidneys function every single day. And they do it in ways that are mostly good, but sometimes dangerous. And the difference between the good and the dangerous often comes down to the small details that nobody tells you about. And that is exactly what we are going to cover today. So let us start with the first one. And let us start with amlodipine, which is a calcium channel blocker. And I know that phrase sounds like medical jargon, but let me break it down for you in a way that actually makes sense. And you will remember it, because remembering it could be the difference between calling your doctor and ignoring a symptom that should never be ignored. So when you take amlodipine, what it does is it relaxes the muscles in your blood vessels by blocking calcium from entering those muscle cells. And when those muscles relax, your blood vessels widen. And when your blood vessels widen, your blood pressure drops. And that is the intended effect. And that is the reason you are taking it. But here is where things get interesting, and here is where the pause becomes important, because amlodipine is known for causing swelling in the ankles and feet and legs. And I am not talking about a little puffiness that goes away after you put your feet up. I am talking about swelling that can become so significant that your shoes do not fit and your socks leave deep indentations, and you start to wonder if something else is going on. And I want to say this very clearly, and I want you to hear it because it matters. Amlodipine-induced swelling is usually not heart failure, and that is a very common fear that people have. But I need you to understand that just because it is not heart failure does not mean it is nothing, and it does not mean you should ignore it, and it does not mean you should just accept it as a normal part of getting older, because there is a difference between a side effect that is manageable and a side effect that is a warning sign. And the trick is knowing what to watch for and how to talk to your doctor about it, because sometimes the swelling is just the medication doing its thing, and sometimes the swelling is your body telling you that your dose is too high, or that your circulation is compromised, or that there is another underlying condition that needs to be addressed. And I have seen patients who just shrugged off the swelling because they thought it was normal. And I have seen patients who stopped taking their medication completely because they were afraid. And both of those reactions are dangerous for different reasons. And the middle path, which is the path of understanding, is the only path that keeps you safe. So if you are taking amlodipine and you notice swelling in your lower extremities, do not panic, but do not dismiss it either, because you need to document it and you need to track it and you need to bring that information to your doctor and you need to have a conversation about whether your dose is right for you and whether there are other medications that could be added to reduce the swelling, such as an ACE inhibitor or an ARB, which we are going to talk about in just a minute, because the combination approach is often more effective and often causes fewer side effects than a single high-dose medication. And that is one of those things that nobody tells you, but now you know, so make sure you remember it. Now let us move to Lisinopril, which is an ACE inhibitor. And this medication works by blocking an enzyme that produces a chemical called angiotensin II, which is a powerful vasoconstrictor, which is a fancy way of saying it narrows your blood vessels. And when you narrow blood vessels, your blood pressure goes up. So by blocking that enzyme, you keep your blood vessels relaxed and your blood pressure comes down. And that is the good news. The bad news is that lisinopril is notorious for causing a persistent dry cough. And I am not talking about a cough that comes and goes with the seasons or a cough that you get when you have a cold. I am talking about a cough that starts sometimes months after you begin taking the medication. And it does not go away, and it does not respond to cough syrup or throat lozenges or any of the home remedies that you might try. And it can be so frustrating and so irritating and so disruptive to your sleep and your social life and your peace of mind that many people end up stopping the medication on their own without telling their doctor. And that is a huge mistake, because stopping an ACE inhibitor abruptly can cause your blood pressure to spike, and that spike can lead to a stroke or a heart attack. And that is not a scare tactic, that is a medical fact. And the reason I am telling you this is not to scare you, but to prepare you, because if you know that lisinopril can cause a cough, you can have a conversation with your doctor about switching to a different class of medication like an ARB, which we are about to discuss, and you can make that switch safely and smoothly without putting yourself at risk. And that is the whole point of this video, to give you the information you need to be an active participant in your own healthcare. Because you cannot advocate for yourself if you do not know what you are advocating for, and you cannot ask the right questions if you do not know what questions to ask. And you cannot recognize a serious side effect if you do not know what it looks like. And I want to emphasize this because it is so important. Lisinopril can also cause a severe reaction called angioedema. And angioedema is swelling of the lips and tongue and face and throat. And it is a medical emergency, and it requires immediate attention. And I am not using the word emergency lightly, because when your throat starts to swell, it can close off your airway, and that can be fatal within minutes. And I know that sounds dramatic, but I have seen it happen. And I have seen people wait too long because they thought it was just an allergic reaction to something they ate or something they touched, and they did not connect it to the medication they had been taking for months or even years, and that delay can cost you your life. So I am telling you right now, if you are taking lisinopril and you experience any swelling in your face or lips or tongue or throat, you do not wait. You do not call your friend. You do not Google your symptoms. You call an ambulance, or you have someone drive you to the emergency room immediately, and you tell the medical staff that you are taking lisinopril because that piece of information could save your life. And I am not saying this to be alarming. I am saying this because it is true, and because it is one of those things that falls through the cracks in patient education, and I refuse to let that happen to you. And now let us talk about Losartan, which is an ARB. An ARB stands for angiotensin receptor blocker, and it works in a way that is similar to lisinopril, but with one major difference that makes it a game changer for a lot of people. And that difference is that Losartan does not typically cause that chronic dry cough that makes lisinopril so hard to tolerate. And that is because instead of blocking the enzyme that produces angiotensin II, it blocks the receptor that angiotensin II binds to, so you get the blood pressure lowering effect without the cough. And that is a huge relief for many patients. But here is the catch, and there is always a catch. Both Losartan and lisinopril can increase your potassium levels. And I know that sounds like a small detail, but it is actually one of the most dangerous things about these medications. And I want you to pay very close attention to this part, because it is where a lot of people get into trouble without even realizing it. So when you take Losartan or lisinopril, your kidneys hold on to more potassium. And that is usually not a problem under normal circumstances, but it becomes a major problem when you start taking potassium supplements or using salt substitutes that contain potassium, or drinking sports drinks that are loaded with electrolytes, or mixing electrolyte powders into your water because you think you are being healthy. And what happens is your potassium levels can go from normal to dangerous very quickly. And high potassium is not something you want to mess around with because it can cause muscle weakness and fatigue and cramps and tingling and irregular heartbeats. And in severe cases, it can cause cardiac arrest. And I am not exaggerating when I say that because I have treated patients who came to the emergency room with their heart rhythm completely out of control. And the only thing we could point to was an interaction between their blood pressure medication and a potassium supplement that they thought was harmless. And that is the kind of thing that keeps me up at night because it is so preventable. And yet it happens all the time, and I want to make sure it does not happen to you. So I am telling you right now, if you are taking Losartan or Lisinopril, you need to be very careful about anything that contains potassium, and you need to talk to your doctor before you take any supplement or use any salt substitute or drink any sports drink or electrolyte beverage. And I know that sounds like a lot, but it is worth it because the alternative is a trip to the hospital that you could have avoided with a simple conversation and a little bit of awareness. Now let us talk about something that affects all three of these medications, and that is dehydration. And I am not talking about the kind of dehydration that makes you thirsty on a hot day. I am talking about the kind of dehydration that comes from illness or vomiting or diarrhea or excessive sweating. And what happens when you are dehydrated is that your blood pressure drops because you have less fluid in your bloodstream. And when you take a blood pressure medication on top of that, you can drop your blood pressure too low, and that can cause dizziness and fainting and falls and fractures and kidney injury. And it is a cascade of bad things that can happen very quickly, and it is completely preventable if you know what to do. And that is why I want every single person watching this video to ask their doctor for a sick day plan. And I want you to ask it today before you get sick, because when you are sick is not the time to figure out what to do. And when you are in the middle of a fever and you are vomiting and you are confused is not the time to try to remember what your doctor said 6 months ago. So get a sick day plan now, and that plan should tell you exactly what to do with your blood pressure medication. When you are sick, should you take it? Should you skip it? Should you cut the dose in half? And that plan should also tell you when to call the doctor and when to go to the emergency room. And having that plan in writing gives you peace of mind, and it gives you a clear path forward when things get complicated, and it can literally save your life. Because the combination of dehydration and blood pressure medication is a lot more dangerous than most people realize. And the reason it is so dangerous is that your kidneys rely on a certain amount of blood flow to function properly. And when your blood pressure drops too low, your kidneys start to suffer. And when your kidneys suffer, you start to retain toxins and your electrolytes go out of balance. And before you know it, you are in a medical crisis that started with something as simple as a stomach bug. And that is why I am spending so much time on this, because it is one of the most underappreciated risks of blood pressure medication. And it is one of the easiest to mitigate if you have the right information and the right plan in place. And while we are on the subject of things you should avoid, let me talk about common pain relievers, because this is a huge deal. And I do not think enough people talk about it when you are taking Losartan or Lisinopril, and you also take ibuprofen or naproxen, which are non-steroidal anti-inflammatory drugs, or NSAIDs. You are putting your kidneys at risk because those pain relievers reduce blood flow to the kidneys, and the medications already put stress on the kidney's ability to regulate blood pressure. And when you combine them, you are essentially double teaming your kidneys. And that can lead to acute kidney injury, which is a serious condition that can require dialysis and, in some cases, cause permanent damage. And I am not saying you can never take ibuprofen again, but I am saying you need to talk to your doctor about safer pain management options. And you need to be aware that not all pain relievers are created equal, and that acetaminophen, which is Tylenol, is generally safer for your kidneys than ibuprofen or naproxen. And that is a simple switch that can make a big difference. And it is one of those things that is so easy to overlook because you have been taking ibuprofen for headaches for years, and you do not think twice about it, but now that you know the risk, you can make a different choice, and you can protect your kidneys. And that is the kind of practical, actionable information that I want to leave you with, because knowledge is only powerful if you use it, and I want you to use this knowledge to make better decisions for your health. Now, let me address something that is very common with all of these medications, and that is dizziness when you stand up, and this is called orthostatic hypotension. And what happens is that when you stand up, Gravity pulls blood down into your legs, and your body normally responds by constricting your blood vessels to push blood back up to your brain. But when you are taking a blood pressure medication, those blood vessels are relaxed and they do not constrict as quickly or as effectively. So you get a temporary drop in blood pressure that makes you feel dizzy and lightheaded and like you are going to pass out. And this is a big deal because dizziness can lead to falls, and falls can lead to fractures, and fractures in older adults can be devastating. And I am talking about hip fractures and wrist fractures and head injuries that can change the course of your life in an instant. And the really frustrating thing is that a lot of these falls are preventable with a few simple strategies. And the first strategy is to stand up slowly. And I mean really slowly, like sit on the edge of the bed for a minute before you stand, and then stand up and hold on to something for another minute before you start walking. And I know that sounds like a lot, but it is a small price to pay for preventing a fall that could put you in the hospital. And the second strategy is to stay hydrated, because when you are hydrated, your blood volume is higher and your blood pressure is more stable, and you are less likely to experience that dizzy drop when you stand. And the third strategy is to pay attention to your medications and their timing, because taking your blood pressure medication at night instead of the morning can sometimes reduce the dizziness. And that is a conversation you can have with your doctor. So if you are experiencing frequent dizziness or near fainting or balance problems, you need to report that to your doctor, and you need to report it sooner rather than later, because those symptoms are not just annoying, they are dangerous, and they can be managed with adjustments to your medication or your lifestyle, and you do not have to suffer through them silently, and you do not have to accept them as a normal part of aging, because they are not. And there is almost always something that can be done to improve your situation. And I want you to be proactive about that, because your quality of life matters and your safety matters, and you deserve to live without the constant fear of falling every time you stand up. Now, I want to talk about something that causes a lot of unnecessary anxiety, and that is the day-to-day fluctuation in blood pressure readings. Because I have seen people panic when they take their blood pressure at home, and it is higher than it was yesterday or higher than it was in the morning, and they think something is terribly wrong, and they want to take an extra pill or skip their next dose. And I am telling you right now, that is a dangerous reaction, because blood pressure naturally changes throughout the day, and it is influenced by stress and food and caffeine and activity and the time of day and even the position of your arm when you take the measurement. So one unusual reading is usually not a cause for panic, and you should not make any changes to your medication based on a single reading, because that is exactly how people end up in the emergency room with dangerously low blood pressure or dangerously high blood pressure from erratic dosing. And the correct approach is to measure your blood pressure consistently under the same conditions every day at the same time, using the same arm and in the same position, and then track it over time and look at the trend, not the individual numbers. And if you see a consistent upward trend or a consistent downward trend over several days, that is when you call your doctor, and that is when you have a conversation about whether your medication needs to be adjusted. But you never ever take extra doses or skip doses based on a single reading, because these medications are not designed to be used as needed. They are designed to be taken consistently every day, and when you take them consistently, they do their job and they keep your blood pressure stable, and they protect your heart and your brain and your kidneys from the long-term damage of uncontrolled hypertension. And that is the goal, and that is the reason you are taking them in the first place. So do not let a momentary spike in your blood pressure reading undo all of that good work, because that is exactly what can happen when you act on impulse instead of information. And I want to close this part by saying something that I hope stays with you long after this video ends. And that is that these medications are your allies when you understand them, and they are your enemies when you ignore them. And the difference is entirely in your hands. And I do not mean that in a guilt-tripping way. I mean it in an empowering way, because you have the power to learn, and you have the power to ask questions, and you have the power to recognize warning signs, and you have the power to be an active participant in your own healthcare. And that is not a burden, that is a gift. Because the more you know, the safer you are and the more control you have over your health outcomes. And I have seen patients who took the time to learn about their medications, and they lived longer, and they lived better, and they avoided complications that could have been catastrophic. And I have seen patients who did not take the time, and they ended up in the hospital with conditions that were entirely preventable. And I am not telling you that to scare you. I am telling you that to motivate you, because I genuinely care about your health, and I genuinely want you to thrive. And I genuinely believe that you can do this if you have the right information and the right support. So let me summarize the key points in a way that will stick with you and you can refer back to anytime you need a reminder. And the first point is that amlodipine is a calcium channel blocker that relaxes blood vessels but can cause swelling in the ankles and feet and legs. And that swelling is usually not heart failure, but it should be discussed with your doctor and you should never ignore it because it might indicate that your dose is too high or that another medication should be added to manage it. And the second point is that lisinopril is an ACE inhibitor that can cause a persistent dry cough. And sometimes that cough does not start until months after you begin the medication. And it is often a reason to switch to a different class of medication. And it can also cause angioedema, which is a medical emergency with swelling of the lips and tongue and face and throat. And that requires immediate medical attention. And you should never hesitate to call for help if you experience that symptom. And the third point is that Losartan is an ARB that works similarly to lisinopril, but usually does not cause a cough, and that makes it a good alternative for people who cannot tolerate lisinopril. But both Losartan and lisinopril can increase potassium levels. So you need to be careful with salt substitutes and potassium supplements and sports drinks and electrolyte powders, because they can push your potassium to dangerous levels. And high potassium can cause muscle weakness and fatigue and cramps and tingling and irregular heartbeats. And that is a serious medical issue that should not be ignored. And the fourth point is that dehydration from illness or vomiting or diarrhea or excessive sweating can make your blood pressure drop too low, and that can cause dizziness and fainting and kidney injury. So you need to have a sick day plan from your doctor that tells you exactly what to do with your medications when you are sick. And you need to have that plan in writing, and you need to review it before you get sick so you are prepared. And the fifth point is that common pain relievers like ibuprofen and naproxen can increase the risk of kidney problems when combined with Losartan or lisinopril. So you should talk to your doctor about safer alternatives. And you should consider acetaminophen as a safer option for pain relief. And the sixth point is that dizziness when standing up is a common side effect, and it can increase the risk of falls and fractures. So you need to stand up slowly and stay hydrated and report frequent dizziness to your doctor. And the seventh point is that blood pressure naturally changes throughout the day. So one unusual reading is not a cause for panic. And you should never take extra doses or skip doses based on a single reading, and you should measure your blood pressure consistently under the same conditions and track it over time and contact your doctor if you see a consistent trend that concerns you. And the eighth point is that these medications work best when taken consistently as prescribed, and they should not be used as needed. And your commitment to taking them every day is what keeps your blood pressure under control and protects you from the long-term complications of hypertension. And now I want to go a little deeper because I think it is important to understand not just the side effects, but also the protective benefits of these medications. Because when you know what they are doing for you, it makes it easier to tolerate the challenges, and it makes it easier to stay motivated to take them every day. And I want you to understand that these medications are not just lowering a number on a machine. They are protecting your blood vessels from the constant wear and tear of high blood pressure. And that wear and tear is what leads to aneurysms and strokes and heart attacks and kidney failure and vision loss and all of the things that we associate with aging, but are actually the result of untreated or undertreated hypertension. So when you take your blood pressure pill every morning, you are doing something profoundly important for your future self, and you are reducing your risk of the most devastating health events that can happen to a person. And that is not a small thing, that is a monumental thing. And I think we do not celebrate it enough. And I think we do not give ourselves enough credit for the discipline it takes to take a pill every single day for years. And I want to acknowledge that, and I want to honor that, because it is not easy and it is not simple, and it is not something that everyone can do. And the fact that you are doing it means you are already ahead of the curve and you are already taking your health seriously. And I just want to add one more layer to that. And that is the emotional aspect of taking blood pressure medication. Because I know that for some people there is a sense of failure or a sense of weakness or a sense of being broken because they have to take a pill to stay healthy. And I want to challenge that narrative because it is not true. And it is not helpful, and it is not fair to yourself, because high blood pressure is a chronic condition that has genetic and environmental and lifestyle components. And it is not a moral failing, and it is not a sign that you are weak, and it is not a punishment for something you did wrong. And taking medication to manage it is not a sign of defeat. It is a sign of wisdom, and it is a sign of self-care, and it is a sign that you are willing to do what it takes to stay alive and stay healthy and stay present for the people who love you. And I think that is something to be be proud of, not something to be ashamed of. And I think that if we can shift our mindset around medication from one of burden to one of blessing, it changes everything about how we experience our health. And it changes our willingness to stick with the treatment, and it changes our openness to learning about what we are taking and why. And that is the kind of transformation that I want for every single person watching this video. So let me take a moment to really sit with the reality of what it means to be on one of these medications for the long haul. And let me be honest with you about the fact that none of these medications is perfect, and none of them is without risk, and none of them is a magic bullet. And the reason I am telling you that is not to discourage you, but to prepare you, because the truth is that managing blood pressure is a lifelong journey, and it is a journey that requires patience and persistence and partnership with your healthcare provider, and it is a journey that involves trial and error and dose adjustments, and sometimes switching medications, and sometimes adding medications, and sometimes dealing with side effects that are frustrating and uncomfortable. And it is a journey that can feel lonely and confusing and overwhelming at times. But I want you to know that you are not alone, and that there are resources, and there are communities, and there are healthcare professionals who genuinely want to help you. And I want to be one of those resources for you, and I want to be a voice of reason and a voice of clarity in a sea of confusing and conflicting information. And I want to be a voice that tells you the truth in a way that is compassionate and direct and actionable. And I want to be a voice that empowers you to take control of your health and to ask the hard questions and to demand the kind of care that you deserve, because you do deserve it, and you do have the right to understand what is happening in your body, and you do have the right to a doctor who listens to you, and you do have the right to a treatment plan that fits your life and your values and your goals. And I want you to know that if you are not getting that right now, you have the power to change that, and you have the power to find a provider who will meet you where you are, and you have the power to advocate for yourself, and you have the power to say, I need more information, or I am not comfortable with this side effect, or I want to explore other options. Because your health is too important to settle for less, and your life is too precious to leave in the hands of someone who does not take the time to explain things to you in a way that you can understand. And I also want to address the financial side of things, because I know that for many people, the cost of these medications can be a source of stress, and I know that some people skip doses or cut pills in half or stretch out their prescriptions to save money. And I want to tell you that there are resources available to help you afford your medications. And there are generic versions of all three of these drugs that are very affordable. And there are patient assistance programs, and there are discount cards, and there are mail order pharmacies that can reduce your costs. And I want you to know that your health is not something you should compromise on for financial reasons, and that there are ways to get the care you need without breaking the bank. And I encourage you to talk to your doctor or your pharmacist about cost-saving options, because they have seen this before and they know how to help, and they want to help. And sometimes all it takes is asking the question to open the door to a solution that you did not know existed. And I want you to take that step, because the alternative is skipping doses. And that is dangerous. And that can lead to the very complications that you are trying to avoid. And those complications are far more expensive than the medication ever will be. So please do not let cost be the reason you put yourself at risk, because there is always a way, and there is always help, and you just have to ask. Now, I want to spend a little bit of time on what happens if you miss a dose, because this is a question that comes up all the time, and I want to give you a clear answer that you can rely on. And the answer is that if you miss a dose, you should take it as soon as you remember, unless it is almost time for your next dose. And in that case, you should skip the missed dose and take your next dose at the regular time. And you should never double up to make up for a missed dose, because that can cause your blood pressure to drop too low, and that can be dangerous. And I know that sounds simple, but it is one of those things that people get wrong all the time, because they think more is better, or they think they need to catch up, and they end up in the emergency room with dizziness or fainting or dangerously low blood pressure, and that is completely avoidable with a little bit of knowledge and a little bit of discipline. And I want to emphasize that consistency is the key to success with these medications. And the more consistent you are, the more effective they are, and the fewer fluctuations you will have in your blood pressure, and the better you will feel overall. And I know that life gets busy, and sometimes you forget, and that is human, and that is okay. But the important thing is to have a plan for when you forget and to not let one missed dose turn into a pattern of missed doses, because that is when the real damage happens. And that is when your blood pressure starts to creep up, and that is when you lose the protective benefits of the medication. And that is when you put yourself at risk for stroke and heart attack and kidney disease and all of the things that you are trying to prevent. So be kind to yourself when you forget, but also be serious about getting back on track. And if you find that you are forgetting frequently, you might want to set a daily alarm or use a pill organizer or pair your medication with a daily habit like brushing your teeth to make it automatic.